Welcome back. February is Heart Month. It's a time to spread awareness about risks for heart disease and heart-healthy habits. Tonight, in part one of a series, our Allie Martin tells us about atrial fibrillation, or AFib, how it's detected, and some treatment options.
As a cardiologist, Dr. Barry Bertollet keeps up with the latest technology for medical professionals and the public. He is especially excited about a mobile EKG called Cardia.
And that's the EKG. It says it was normal.
It allows anyone to get an accurate reading of their heartbeat, and it can detect abnormalities such as atrial fibrillation or AFib.
Normally our heartbeat is the top and the bottom part of the heartbeat together, so it's lub dub, lub dub, lub dub. And when you have atrial fibrillation, the top part of the heart starts beating erratically. And so we sort of see this erratic beat at the top, and then the bottom part of your heart then beats irregular with that.
While AFib is not life-threatening on its own, it is the leading cause of stroke for older adults. About 10% of adults 65 years and older will be diagnosed with AFib.
The strokes that we see with atrial fibrillation, they're usually bigger strokes, and they're the ones that are more likely to cause long-term consequences, even putting people in nursing homes with that. So if we can detect AFib early and then treat it, then we can prevent those subsequent strokes with that.
Once a patient is diagnosed with AFib, there are several treatment options. Blood thinners are usually prescribed at first. If that doesn't work, a minimally invasive procedure known as catheter ablation is performed.
Procedure takes about an hour and a half or 2 hours, and all of this is done through the groin. We put these long tubes called catheters. We go inside the heart and identify certain culprit areas in the heart chambers that are causing this atrial fibrillation. One of the common steps involved is called ablation, which is delivering heat and cauterizing these irritable spots to keep their heart from doing this atrial fibrillation often.
Dr. Karthik Prasad also works with Cardiology Associates. He has treated many AFib patients with catheter ablation and says the earlier it's caught, the better the outcome.
Some folks, when they've spent too much time in atrial fibrillation, you can develop what we call heart failure, where your heart function goes down, your breathing gets further labored, and you're in the hospital often. And in some of those patients, when we've done this ablation procedure, we have seen things turn around completely.
Doctors also say leading a healthy lifestyle can reduce risks of high blood pressure and other factors that can contribute to AFib. In Tupelo, Allie Martin, WCBI News.
And tomorrow we'll meet a woman who had AFib and underwent the catheter ablation procedure.